decades to days. I mean, that sounds like something straight out of a movie, right? But what if I told you it's not science fiction anymore? This is the new reality of how we create life-saving medicine. So yeah, let's get right into it. Oh, and before we really jump in, just want to give a quick shout out. This whole explainer is brought to you by our friends at Colaberry Labs. That's Colaberry Labs.
Okay, so I want you to just for a second picture this. We're in a lab, but it's the year 2030. Generative models are designing drug candidates at dawn, and by noon, virtual patients are already predicting how well they'll work. I mean, that is the finish line. That's the dream. But to really truly appreciate how mind-blowing that is, we've got to look at where we started. And trust me, the starting line, it wasn't a sprint. It was more like a brutal, punishing, multi-year marathon. So let's rewind the clock and look at the old way of doing things.
First off, let's talk about time. We're talking more than 10 years. Think about that. A full decade for just one new medicine to get from an idea in a lab all the way to a pharmacy shelf. And you know, that 10-year journey, it came with a price tag that is just staggering. Over $2 billion. B with a B. For one single successful drug.
So why so long? Why so much money? Well, this right here tells the story. A 90% failure rate. I mean, that is just brutal. For every 10 drugs that looked promising, 9 of them, poof, gone, failed. It was a system just built on hoping for the best and a whole lot of waste. So you get the picture, right? The whole industry was basically drowning in data, but totally starving for insights. They had mountains of information, but figuring it all out was this slow, painful, manual grind. Just endless trial and error. But then a few new tools showed up, and they changed everything. This is really where the story takes a huge turn. We've got 3 specific AI tools that show up on the scene, and they're the catalysts for this whole revolution. And we're not just talking about speeding up the old way of doing things, nope. They created a whole new playbook. Okay, catalyst number 1, ChemAI. The easiest way to think about this is like an AI chemist. It can dream up and test millions of different drug molecules, all on a computer, that's what in silico means, before anyone even touches a test tube. This just completely leapfrogs years of slow manual lab work, and you can bet the industry noticed. Look at this. The buzz and engagement scores for these kinds of tools just shot through the roof. We're talking high 80s, low 90s. That's not just hype. That's people getting genuinely excited and actually starting to use this stuff. And here's the proof in the pudding. 46 days. A process that used to take years was crunched down into just 46 days. That's not just getting a little bit faster. That is a fundamental, ground-up reimagining of how research and development is done. All right, so ChemAI is amazing, right? It helps us design the perfect key. But what good is a key if you have no idea which lock it's supposed to open? That's where catalyst number 2, GenomixAI, comes into play. It's the tool that decodes our biology. It dives into these massive omics datasets, all that super complex info from our genes and proteins, to figure out exactly what to target in the body, and, even cooler, who a drug is most likely to help. And check this out, the engagement score is actually higher than the buzz score. You know what that tells me? This wasn't just industry chatter. This was a tool that solved a real critical problem. It was about taking the guesswork out of the equation and finally making medicine personal. I absolutely love this analogy I came across. If ChemAI gave us better tools, GenomixAI gave us better maps. It just clicks, right? One builds the super fast car, and the other provides the pinpoint accurate GPS to navigate the crazy complex highways inside our bodies. Okay, on to our third and final catalyst, and this one tackles a problem we can probably all relate to: information overload. It's called BioGPT. I mean, hundreds of thousands of research papers get published every year. No human brain can possibly keep up with that. But BioGPT can. It's an LLM that's been trained on millions of these papers, and it can read, remember, and connect the dots across decades of research in seconds. So yeah, no surprise here. The interest was massive. Researchers looked at this and immediately saw a way to get rid of one of their biggest headaches: just digging and digging and digging for information.
Someone described it as having a super researcher on call 24/7. And that's exactly what it is. It's like every single scientist on the planet suddenly got a genius research assistant who's read everything, ever, and is just waiting to help.
So think about it. You put these three things together: the molecule designer, the biology mapper, and the all-knowing knowledge engine. What you get isn't just a faster process. You get a whole new game. The rules have been completely rewritten. And this is maybe the coolest part. It totally changes what it means to be a scientist. Before, so much of their time was spent on manual grunt work, sifting through papers, endless trial and error in the lab. Now they're the pilot. They have an AI co-pilot handling the tedious stuff, freeing them up to be strategic thinkers, to ask the big questions, and to design the really creative experiments that actually lead to breakthroughs. Okay, so this is a great story about drug discovery. But what's really powerful here is that the lessons, they're not just for the pharma industry. What happened here is basically a playbook. It's a model for any industry that's drowning in data and wants to figure out its own AI-powered future. And that, of course, brings us to the big question for you. How do you take this playbook and apply it to your world, to your business? What does this transformation look like in your industry? Well, the good news is you don't have to reinvent the wheel. This kind of massive change actually follows a pretty clear blueprint. A great example is the AI transformation framework from our sponsor, Colaberry. It just makes sense, right? You start with step 1. Get your bearings with a readiness assessment and a clear roadmap. Then, step 2, you have to modernize your data, because AI is useless with bad data. Step 3, then you can start to integrate AI and automate things. But, and this is crucial, step 4 is about your people, talent, and upskilling. And finally, step 5, you build a system that can constantly evolve. See? It's a real, tangible path from where you are today to where you want to be tomorrow. So yeah, the biopharma world has shown us exactly what's possible when you go all in on AI. The cure really has been accelerated. And honestly, it makes you wonder, what's next? The race is officially on to see what other huge grand challenges we're going to conquer with this technology. And that's our look at AI's accelerated cure. This explainer, once again, was brought to you by Colaberry Labs. If you want to find that playbook for your own transformation and figure out how to get started, you can find it all at colaberry.com.